why have I been making such a big deal about this? Okay, so why is getting the right diagnosis important? And I keep saying, oh, typical bacteria, atypical bacteria, what is that all about? Okay, the key thing to note is that the treatment for mycoplasma pneumonia is very different from the usual treatment of all the other kind of typical bacterial pneumonias that we're used to treating in pediatrics. And so what is it? So azithromycin, or Z-Pak, is essentially the treatment for mycoplasma pneumonia in kids. There are others that I've listed here, but really not important for you to know. But what I do want to point out, and this is just from the outpatient pneumonia clinical guidelines from the Children's Hospital of Philadelphia, is that the first line therapy for most pneumonias in pediatrics is amoxicillin. So this treats typical bacteria like Streptococcus pneumoniae. It does not treat mycoplasma pneumonia. And so this is the problem. As a pediatric resident, and then even as a fellow, it's kind of drilled into your head to think like, hey, if a kid is younger and you have a typical pneumonia, amoxicillin is a good first-line therapy. And then if they're in the hospital, you give them ceftriaxone, but that also does not cover mycoplasma. And you can see here in their pathway, they even said, hey, consider diagnostic testing and treatment for atypical pneumonia. This is talking about mycoplasma in children over 5 years old with insidious onset of symptoms or failed treatment for typical pneumonia. And so again, just looping back to the very beginning, why is this all like a problem? Well, the problem is that it's the 0 to 4-year-old age group where these cases were spiking. And for me as a pediatrician, I'm just usually not thinking about that.